Dear committee, dear audience, good morning. My PhD topic is exploring HPV-associated disease and their preventive measures. My name is Adél Mózes. I'm a first-year PhD student and dentist from the Department of Pediatric Dentistry and Orthodontics. My mission is to decrease the prevalence of HPV-caused diseases, and my vision is to find the best options for HPV prevention and detection. Allow me to introduce our two specific goals. Our first is to reveal the prevalence and risk of oral HPV infection in cervical HPV-positive women through a systematic review and meta-analysis. And our second is to analyze the concordance and risk factors between oral and genital HPV. So let's jump to our first project, which started in September. As you know, HPV is the most common sexually transmitted pathogen of the 21st century, causing more than 5% of the cancers worldwide. Besides cervical cancer, HPV can also cause oropharyngeal, anal, vaginal, vulvar, and perineal cancer. In addition, the prevalence of HPV-caused oropharyngeal cancer has quadrupled in the recent years. Therefore, our aim is to identify the association between cervical and oral HPV infection. Our first clinical question is, what is the prevalence of oral HPV infection in women with cervical HPV? We hypothesize that women with cervical HPV infection have a high prevalence of oral HPV. And our second question is, does cervical HPV infection increase the risk of oral HPV infection in women? We hypothesize that cervical HPV infection increases the risk of oral HPV in women. We conducted our search in 3 separate databases with the search key below. And after the selection, we ended up with 41 eligible full text. Here you can see our outcomes, which were measured in odds ratio or in proportion with a 95% confidence interval. And allow me to present our results. In our first result, we measured the outcome in proportion in odds ratio with a 95% confidence interval. So here we investigated how many women had oral HPV in the cervical HPV positive versus the cervical HPV negative group. We included 34 prospective cross-sectional studies with more than 5,000 patients. The heterogeneity was moderate, which can be explained by the different oral sampling methods and virus detection procedures, the globally and individually different sexual habits, and the HPV positivity or negativity of the sexual partner. We got that the odds of having oral HPV in the cervical HPV positive group is 2.22 times higher compared to the cervical HPV negative group. Our result is clinically and statistically significant. When we measured the outcome in proportion with a 95% confidence interval in the cervical HPV negative and cervical HPV positive group, we included 34 and 41 prospective cross-sectional studies with more than 2,000 and 4,000 patients. The heterogeneity was high, which can be explained, as I mentioned before. And we got that the prevalence of oral HPV in women without cervical HPV is 4%. Until then, this prevalence is 13% in women with cervical HPV. This result is also clinically significant. Globally, the prevalence of oral HPV is between 5 and 10% at the population level, they say. And when we created a subgroup for women with cervical HPV and with positive cytology and measured the outcome in proportion, we got an even higher number for oral HPV, 17%, which is also clinically significant, and it's quite reasonable because those who have positive cytology have had HPV for a longer time, giving the virus presumably more time to infect the oral cavity during sexual activity. According to the strength of our work, we present worldwide data. HPV was confirmed by PCR in all articles, and we set a minimum genotype requirement for inclusion. I have to note that there is no standardized oral sampling technique. This is one of the biggest limitations of our work. We can conclude that women with cervical HPV have a 2.22 times higher odds for oral HPV positivity, and 1 out of 8 women with cervical HPV has oral HPV too. For practice, we imply that oral HPV screening should be recommended for women with cervical HPV infection with their partners. There is a need to raise awareness for oral HPV and its risk for cancer, and the HPV vaccination should be emphasized. For research, we imply the effectiveness of oral HPV testing in the early diagnosis of oropharyngeal cancer should be investigated. Here you can see the progress of our first project. Our first journal of choice was the Journal of Dental Research, and our manuscript now is under review there. And let's move on to our second project. We started in November. As we know, HPV infects the oral cavity and oropharynx through oral sex, and why there is cervical HPV screening and the rates of cervical cancer is decreasing. Until then, there is no oral HPV screening, and the incidence of HPV-positive oropharyngeal cancer is increasing in the developed countries. There are some well-known risk factors for oral HPV, such as oral sex, greater number of lifetime sexual partners, smoking, stress. Therefore, our aim is to identify the risk factors and the association between genital and oral HPV infection. Our first question would be, what is the concordance between oral and genital HPV in women and men? We hypothesize that there is concordance between the oral and genital HPV infection. The clinical implication would be to determine who should be screened for oropharyngeal cancer prevention. And our second question is, who do lifestyle factors influence HPV positivity in women? We hypothesize that some lifestyle factors are associated with HPV positivity. The clinical implication would be to identify who needs close follow-up and screening, and strategies for education and prevention. We are at the data extraction stage. We are collecting more than 2,000 patients' data. We are collecting the general medical history and the lifestyle factors, and of course the HPV screening results. Here you can see the summary for aims with the submission and planned submission dates. And I would like to thank you for your attention. To quote Albert Einstein, the more I learn, the more I realize how much I don't know. Thank you.
I would like to ask you as a doctor, what protective factor would you suggest against HPV?
I would recommend consistent condom use and vaccination against HPV.
Those subjects who were included, had they have any of them vaccination before, or?
We didn't see or include or exclude the vaccination part, because you can carry HPV while you are vaccinated, but it won't develop to cancer. So you can test it for positive for HPV if you are vaccinated, but you are safe.
Regarding your previous answer, do the male vaccination has any effect, or does it make sense? Or?
Yes.
Okay.
Yes, against perineal cancer, and for males, the oropharyngeal cancer is most serious, and the FDA approved the Gardasil 9 vaccine against oropharyngeal cancer in a few years ago.
And what about the smoking? Because I understand
yes,
most of the predictive factors,
yes,
but how the smoking?
Yes. Okay, so at some point of your life, you will get HPV at least, but if you have a good immune system, you will get rid of it. The question is, can your immune system get rid of it, HPV? When you are smoking, your immune system is very low, and you cannot get rid of HPV, and of course, it's a very big risk factor for oropharyngeal cancer and oral cancer, the smoking. So if we have these two risk factors and maybe drinking or something else, it's a very serious, and those men are in danger.
I would have a question regarding your first project. Also, on this plot or the last one, I was able to see some outliers, and maybe as I see from here, somewhere the authors are the same, so maybe they are the same articles. So what's behind this reason?
They are not the same articles, and the outliers. Crawford had a population with women with positive cytology. Adamopoulos and Vidotti used nested PCR test, which is more sensitive than the regular PCR. And Fernandez population were women with positive cytology, and also these women were in prison.
Mm-hmm. And if you go further, one slide, please. Yeah, so there, I think the last one on the left side and the one before the last on the right side are the same article, right? Or not? I'm not able to see it. But therefore, there are way on the right side.
Yes.
So is it because of the method or the population, or?
I would say the population, and also because there is no standardized oral sampling method and technique.
Okay, thanks.